Okay, I'm going to tell you about my friend Sarah. A few months back, Sarah was riding her bike to school here at Fullerton College, and she crashed and broke her wrist. Obviously, she had no idea what to do, so she was rushed to the hospital in an ambulance because she had a compound fracture, and so they fixed her wrist, and she was sent home. When she got home, she thought, well, that's the end of that. I'll just let my wrist heal and get my cast off, and that's it. Little did she know, about 2 weeks later, her bill came in the mail. $10,000. $10,000 that she had to pay for her wrist being broken. She was really confused. She asked her mom, she said, "Mom, why is it so much? I wasn't even sick. All I did was break my wrist." And her mom said, "Sarah, you're uninsured. You have no health insurance. So therefore you have nobody to help you lower the cost of your medical attention." This is a problem with a lot of young adults in our country. They're very uneducated about the healthcare process and what it can do for them as a generation and as a young adult. In this speech, I will inform you about the Covered California program and what it will do for our generation. I will inform you about the bronze and silver packages and give examples of the difference between them. And I will inform you about how health insurance can help you in the future and how it's beneficial to us as a group of listeners. So first, I'm going to inform you about what exactly the Covered California plan is and how it affects our country. Covered California is a branch of the Affordable Care Act that's specifically designed for Californians. According to the New York Times, Robert Pierce states that 1.4 million Americans will be helped by the Affordable Care Act in the year of 2014, and 48 million Americans were uninsured in the year of 2012. The Affordable Care Act was put in effect to ensure that every American has an equal opportunity to have health care. Covered California has 3 basic plans that are available to Californians: the bronze, silver, and gold package. There is also a platinum package, but the bronze, silver, and gold package are the 3 that are most dominant for the incomes of Californians. 7 million Californians are uninsured in this state, and that's a problem because we all have an equal opportunity to have health care as of now through Covered California. Now that I've informed you of what exactly Covered California is, I'm going to inform you about the bronze and silver packages. The bronze and silver packages are the 2 basic packages that are available through the Covered California program. The bronze package is available for people like me, for example, who don't often get sick. I rarely go to the doctor because everything usually that I get sick with is able to be treated with over-the-counter medicine. So the bronze package is available for sort of a higher monthly payment that you would pay monthly with the rest of your bills or insurance policies, and a very high copay. I would pay about $55 to $70 when I go into the doctor for just a normal visit, for like a checkup, or if I have something wrong, I would go to the doctor and pay this much. The bronze package is better for people who do not get sick very often, such as myself. So if you are a healthy person who doesn't really have any pre-existing conditions and you never go to the doctor and you never really went to the doctor as a kid, like myself, the bronze package would be the best option for you. The silver package is available as well. This package is available with a kind of lower monthly payment that is, I guess, more affordable for people who go to the doctor more often. The silver package is better for my friend Ryan, who goes to the doctor a lot. He's sick a lot. He has a pre-existing medical condition. Therefore, he has to go to the doctors for regular checkups, unlike myself. So Ryan would be a better candidate for the silver package because he has lower copays, meaning when he goes into the doctor's office for a visit, he doesn't have to pay as much as I do. Therefore, he pays less out of pocket directly when he goes to the doctor and more with his monthly payments. This option is better for people who get sick more often, like Ryan, because when you pay every month for your insurance policy, you pay directly like with your other bills or however you have your payment plan set up. But when you go into the doctor, you're paying less directly out of your pocket at that moment in time. So it may save you a little bit of money because you don't pay as much directly. Now that I've informed you of the bronze and silver packages, I'm going to tell you exactly what healthcare can be used for in the future. Like Sarah, many young adults, such as myself, we're very uninformed about the healthcare policy and how it affects us directly. Most of us think, oh, healthcare, I don't need that. I'm never sick. I never go to the doctor. I don't need to have healthcare. I don't have a family. I don't have children. I don't plan on having children. But healthcare is not only for people who are planning on getting pregnant and having children, or people who have families that they have to provide for. Healthcare is extremely important for us young adults just because we're of us as individuals. Being an individual with healthcare ensures that we will not have experiences like Sarah. We will not be surprised when our bill comes from the hospital and it's an obscene amount of money and we have no idea how we are going to pay this and how this money came to be. Sarah is definitely not alone. I too have had an experience like this. I got sick, I went to the hospital in an ambulance, and I had no idea how I was going to pay for it. As an individual, the doctors are required to treat you when you go into the hospital, and because they're not going to ask you to pay as soon as you come into the hospital before they treat you. So I had no idea how much my bill was going to be. When I received my bill, I talked to my parents and was confused on how I was going to pay it. They told me that I was still on their health insurance. As of right now, the Affordable Care Act allows people between the ages of 18 to 26 to stay on their parents' health insurance until they turn 26, and then they have to purchase their own health care plan. This is required by law. By February 15th of 2014, everyone in this country is required to have a health care plan, or you will be fined $95 your first year, or 1% of your income, and that price will continue to rise over the years that you do not purchase a healthcare plan. So we can all avoid having an experience like Sarah's and my own by purchasing a healthcare plan and knowing exactly what that healthcare plan can do for us. According to the Huffington Post, many young adults have no idea what they need in a healthcare plan or what they should be paying for a healthcare plan. This is why all of us need to be more informed and educated about what exactly we need as an individual out of our healthcare provider, and also what exactly we can afford to pay every time that we pay for healthcare each month. In this speech, I informed you of what Covered California is and how it affects our generation, 2 possible plans through the Covered California program, and how health insurance can help you in the future and why it is important to have it. So now I hope that this speech leaves you with a more educated and informed outlook when purchasing your healthcare plan and knowing exactly what you need out of your healthcare and what you can get for the money that you can afford.